Hi everyone, this is Ruby Blow of Development Counts, and this video is about some of the things, well really one main thing that I think therapists encounter a lot as a presenting issue in therapy that really doesn't get talked about in graduate school, that we're not really trained to address. And that issue, unfortunately, is something that everyone experiences. And for the ease of this discussion, I'm going to call it brokenheartedness. Um, so if you want to learn more specifically about what I mean, you can look at my blog post for July 20th, 2016 called Love and Other Ailments. So here's what I'm getting at. In graduate school, we learn, at least in counseling programs, we learn all about um, different conditions: depression, anxiety, schizophrenia, bipolar disorder, adjustment disorder, childhood disorders. And then we learn lots of different theories about how to work with those disorders. Some of them are relationally based, some of them are based on psychodynamics and history, and some of them are grounded in pragmatic approaches, or what we consider to be evidence-based therapy, like cognitive behavioral therapy or dialectical behavior therapy. So we have all of these ideas about what we think is going to treat someone based on their symptoms: depressed mood, anxiety, etc. And I'm not saying that that's not valid. I mean, I've been a therapist for almost 20 years. Well, yeah, 20 years now. And I absolutely think that those methods are beneficial. However, it doesn't always prepare us with with how to address the complex symptoms that people have when they are brokenhearted. And for the sake of this discussion, when I say brokenhearted, I'm talking about someone who is upset and having a sense of loss because of the ending of a relationship, specifically a romantic love relationship. So we're not really taught how to treat that. And so a few things that I think are important as it relates to treating a broken heart is, first, having a really honest assessment on how have we dealt with our own wounds, how have we dealt with our own brokenheartedness, and what are the stories we are telling ourselves about relationships? What do we believe about romantic love relationships? And then how can that impact what we're doing when we're trying to treat clients? And of course, our stuff comes up all the time as it relates to treating any number of things. But I think we have particular blind spots when it comes to our own romantic love relationship patterns that usually anyone who knows us can give us a heads up on. So my recommendation to therapists as it relates to treating romantic love is setting a priority in your own, I would say, personal development. There's not a lot of professional development workshops on this. I'll share with you some of the resources that I read or listen to or I think are helpful. Of course, many of you know about Brene Brown's work, where she talks about shame, vulnerability, and courage. She's a social worker out of Texas and has a lot of work. If you go to her website, brenebrown.com, that's BRENE Brown.com. I also study a cultural anthropologist named Allison Armstrong. She has a website, and don't let the ease of this website fool you. The website is understandmen.com or understandingmen.com. I think both will send you there. She used to have the signature personal development workshop called Celebrating Men, Satisfying Women. But she also does workshops for men as well. And she, from a cultural anthropologist perspective, shares a lot to help people understand who they are in relationships, what triggers them, and where it comes from in our ancestry and our anthropological nature. She talks a lot about that a woman has an inner cave woman and a man has an inner caveman, and so many of the things that we react to and do are based on all these things about our history that we don't fully understand from an anthropological perspective. So I like Allison Armstrong's work as well. One of my favorite books to recommend to single and or married or divorced or never married clients is a book called Lies at the Altar: The Truth About Great Marriages by Dr. Robin Smith. She's based a lot in the Imago approach, but This book is one of the easiest reads I've ever had or ever recommended to clients that really looks at self-exploration. Did I show up like a grown-up is one of her phrases that she talks about. And she really gets at what are those wounds and what's that narrative and what's that story that we thought a relationship would resolve. And then for many of you who are interested in couples therapy, you're probably familiar with John and Julie Gottman and their longitudinal studies. Again, that's more going into clinical practice and evidence-based approaches, which I think are valuable. But the essential thing that I'm getting at here is I think as therapists, we need to do our own work, our own personal development, so that we have a better understanding of what we think is important as it relates to treating brokenheartedness and where we're at in our own healing. And what I write about in the blog that I'm referencing, which is July 20th, 2016, it'll go under like a personal development title. So if you look at this video much later, you'll still be able to find it. It'll be called Love and Other Ailments. Is I talk about this concept that has to do with committing to oneself. Shel Silverstein's book, The Missing Piece Meets the Big O, really illustrates this really well. That often what people are looking for is what Jerry Maguire talked about in the movie. I think it was Jerry Maguire is the name of the movie, where he talks about feeling completed by another person. And the ideal, I think, with romantic love is for two people to come together with as much semblance of wholeness as possible, or the relationship itself is part of a pathway towards wholeness, where both people are committed to their own personal development. Now, of course, you know, anthropologically, we get together to further the species and to have children and to experience joy, pleasure, connection, safety, belonging, and all of that is, of course, important and fun and vital to kind of our human existence. But I would also posit that all the narratives and all the, I guess, social pressures around what it means to have a partnership, a long-term relationship or not, and what it means to do that successfully or not has a major impact on the people that we treat for depression, anxiety, etc. So I would encourage you, do your own work around understanding love, partnership, romantic love, your own heart, brokenheartedness, wholeheartedness, so we can do the best possible job of serving our clients. And if you find out about great resources, I would love to learn about them. And so you can reach out to me, sign up for my e-blast if you're not already on my list. Since this video is going on my YouTube channel, some of you might just view it there and not have received it in my e-blast. And my website is developmentcounts.com, and you can sign up on the homepage. All right. Hope you found this useful, and I'm going to start typing up my blog. I write it by hand, so it's time for me to write it up. Okay, take care, everyone. Bye.